There's a very famous Indian surgeon, Atul Gawande, based in the US. He found out that the risks and misadventures meaning operating on the wrong side, he prepared a manifesto. He made it into a book which was a bestseller called the Checklist Manifesto. You should have a checklist. It could be starting with the patient name, ID of the patient. You mark on the side of surgery which side you're operating, left side or right side. You reduce the risk of having any misadventures. Name of the surgeon, the name of the anesthetist is identified. The nurse asks in the checklist, what is the anticipated time of the surgery? Do you anticipate any major events or complications? Do you identify that you need any blood? The nurse who has scrubbed for the case will say that the instruments and the equipment is adequate. So you lessen the risk of having any miscalculated event or an unforced error while you're operating. More than checklist, you should follow algorithms. There is no shortcut. Follow each step the way it should be.
There are algorithms for neurosurgery as well.
There's a way of doing it. There is a particular way of opening the scalp so that you preserve the blood supply, so that the wound healing is better. There's a particular way of opening the skull. There's a particular way of opening the covering of the brain. There's a particular way of entering into the brain. There's a particular way of removing these lesions, because the brain is as soft as butter. So you have to be very gentle when you remove a tumor, when you remove the blood which has bled inside the brain, without causing much damage to the surrounding structures. And these blood vessels are very, very small, which are the final blood vessels in the brain. There's no way you can tie those blood vessels. There's a particular way of stopping the bleeding in the brain. There are special agents or methods of doing it, various medicines which we can apply on the brain. All this goes as a technique. There is no shortcut, there is no bypass. Maybe if a surgeon has worked 20-30 years, he's devised something, he can make a modification. But to go in and come out, it should be the same way as going in, and you should not be stuck when you're coming out.
You don't miss any
you don't
step.
miss any steps.